I am doing good. How is everybody?
Everybody is going well.
Are you
Yeah,
having a
fine.
good day?
Yeah,
Yes.
fine, good.
It looks like everybody is very busy. Nobody wants to connect today. You should come and learn English. Come and speak English. It's important for you. Yeah? So I shared the words. Who was able to look the words up? Who checked the meaning of the words? Did anybody check?
I check it.
Okay, very good. Who else? Who else checked the words?
Madam Sakira is
He checked it.
crying.
She what?
She cried.
Ah, she's praying.
Yes.
Very good. Yes. All right. Praying is important.
Yes.
Did you all pray? Who forgot to pray today? Who did not pray today? All right. So today we are going to work on health economics. Who knows what?
Economics.
Yes, health economics. Who knows what that is? How do you translate that to French?
Économie de la santé.
Excellent. So today we will see the foundational concepts and terminology relating to health economics.
Tough.
So this is the
Oui, information.
presentation agenda, and so we'll talk about understanding health economics. What does understanding mean in French? Understanding.
Comprehension.
Excellent. So understanding of health economics. And we will also look at some essential health economics vocabulary. What is vocabulary?
Vocabulary.
Okay, but what does it mean? Vocabulary, what does it mean? It means words and their meaning, right? Words and their meaning. And so we'll try to explain key concepts and we'll try to look at a few elements relating to health economics in practice, practice of health economics. And at the end of that, we should be good to go. Okay? All right. Now, let's do a review of key terms, key words relating to health economics. So who was able to look up the meaning of economics? Mr. Ganu, you said that you were able to check those words up. So what does it mean? What does economics mean?
Okay, in French,
Yeah,
economy.
very good. Economy. So can somebody use economics in a sentence in English for all of us? Use economics in English, in English in a sentence. Anybody use economics in a sentence?
Hmm.
Use economics in a sentence. Hmm?
Economic.
Hmm? Hmm?
We have a good economic
Economy is
student in Burkina Faso.
We have good economics in Burkina Faso.
Student.
Oh, good economic students.
Yeah.
All right. That's good. We can also say that we have a, a great number of competent economic specialists in Burkina, right? All right, that is good. So, but in English, what do you think the meaning of economics is in English? What is it? What is economics in English? What is economics?
Economics is
Mm-hmm.
when we speak, when we told economy, we want to tell money.
Mm-hmm. You mean when we talk about economics, it's about talking about money?
Yeah.
Okay, yes, that's yeah, there is definitely a relationship between economics and money, right? But what is it? Economics, it's a science, right?
Science study money.
Uh-huh.
Yes.
Yeah, I know money is an important part of all that, but it's also about uh, production, distribution, and consumption of goods and services, right? Okay, so it's all about the science that studies the production, distribution, and consumption of goods and services. What's the definition or the translation of goods in French? Goods in French, it's what? Les biens et
des biens.
biens et
Bien
services.
et service.
Bien service.
Very good. All right. Healthcare. What is healthcare?
Soins de santé.
Excellent. Healthcare, c'est soins de santé. All right. Now, can somebody use this in a sentence for us? Use healthcare in a sentence in English for everybody.
The hospital
Mm-hmm.
is a center of health care.
Is a center
Of,
for healthcare. Very good. Who was this? Is it Sana or
I'm sorry.
who is it?
He's Gansuri.
Gansore, very good. Plus deux. All right. Anybody else want to use a sentence for that?
I have one example.
Uh-huh.
Access to healthcare is a basic human right.
Wow. This is amazing. Access to healthcare is a basic human right. I like that. Yes. All right. Let's now talk about resources. What is resources?
Resource.
Okay, resource. So use it in a sentence for us in English. Use resources in English. Resources in English in a sentence. Anybody? Anybody? Resources in sentence in English.
Resources
Mm-hmm.
is a stock
Mm-hmm.
of money,
Mm-hmm.
materials.
Mm-hmm. That's it. You finished?
Mhm.
Okay. Resources is a stock of money and materials. Yes. So that is the definition. And you
Mhm.
also used it in a sentence. So very good. Now let's talk about allocation. What is allocation? Allocation.
Allocation.
What is it?
Allocation.
Okay. Allocation in French. Use that in a sentence in English, and let's see. Uh-huh. Allocation in English. What would it be? Allocation. We can say in our in our office, the resource manager performs the allocation of supplies
Il y a trop de bruit là.
Madame Gansonre, anka govno be chihi mikro. Ram chihi nkwen. In our office, the resource manager performs the allocation of supplies on a monthly basis. All right. So who understand what this means? Who knows the meaning in French? In our office, the resource manager performs allocation of supplies on a monthly basis. It means that every month, Mr. Koulibaly gives everybody the material they need for the month. Right? He gives everybody pens, he gives them paperwork, and he gives them money. Meaning he makes the distribution. Okay, distribution of resources. So that's what allocation means. Is this clear for everybody?
Yeah, it's okay, sir.
Yes.
Excellent. Interventions. What does it mean? What's the translation in French?
Intervention.
Mention.
Intervention. Very good. Now, can somebody use the intervention in a sentence in English? Use intervention in English in a sentence. Anybody, everybody. Hmm. Intervention. Hmm?
Early intervention helps children with learning difficulties.
Beautiful. Early intervention helps children with learning difficulties. Who understand this? Can somebody translate this in French for everybody? Anyone, can you translate it in English and French for us?
Une intervention précoce aide les
Uh-huh.
enfants ayant des difficultés d'apprentissage.
Excellent. Very, very good. Societal. What does this mean in French?
Société. Sociétal.
Excellent. Societal. Very good. So, can you use this in an English sentence, in a sentence in English for everybody? Anybody?
It is a group of persons live in the society.
So that is the definition. A group of person living
Living in a society.
together is the society.
Yes.
All right. Now use the adjective. Societal is an adjective. Use adject societal in a sentence. Can anybody use that in a sentence for us? Societal. Hmm? You can say, for example, that child abuse in some countries has become a societal problem, right? Child abuse in some countries has become a societal issue. Okay? So who knows what it means in French? Who can translate that in French? Child abuse in some countries has become a societal problem. Who can translate this in French? Anybody? La maltraitance des enfants dans certains pays est devenue un problème de société. Yeah? All right. Now, welfare. Who can define welfare for us? Welfare. Welfare.
Aide sociale.
Okay. Aide sociale. That is good. Aide sociale is welfare. There is another definition. There is another definition.
Bien.
Yeah. Bien-être.
Bonheur.
Bien-être.
Bonheur.
Bonheur. Joie et tout ça, n'est-ce pas? All right. So, do you want to use this in a sentence for everybody? Use it in a sentence for everybody. Don't sleep. Mm-hmm.
The,
The,
the government.
yes, government. Uh-huh.
Help
Uh-huh.
uh,
Helps.
the people
Uh-huh.
who are ill or poor.
Or ill or poor. I see. So basically, you're saying that the government help people who are ill or poor to achieve
Mm-hmm.
Their welfare.
Okay.
Yeah. Or the government supports the
Mm-hmm.
welfare of the population. Excellent. Very good. I like that. Keep trying. Keep trying. Don't stop. Good job. So scarcity. Can somebody read this and this word for us? Read this for us.
Scarcity.
Scarcity. What is the translation in French?
Rareté.
Very good. Rareté.
Pénurie.
Pénurie. All right. Use it in a sentence for us. Pénurie. Yes. Use it in an English sentence. Anybody, everybody. Mm-hmm.
Scarcity
Mm-hmm.
is the condition of
Mm-hmm.
something being scarce and or deficient.
Scarcity is the condition of something being deficient. Good. Somebody else want to try another sentence? Can somebody else try? Scarcity is a condition of something being deficient. We can also say that there is a pronounced scarcity of clean water in the Sahel region. Yeah, does that make sense? All right, now let's talk about opportunity cost. Opportunity cost.
Good
What is it?
opportunity.
Very good. What is it in terms of economics? What does it mean? Good opportunity.
In French,
No, you. Okay, yes, let's try the definition in French and then we'll transfer that to English. Yes, what is it?
good opportunité,
Mm-hmm.
c'est c'est le coût, en fait, c'est le coût si on a des situations sur lesquelles on peut renoncer à une situation pour avoir un gain d'un autre côté, en fait.
Okay. Donc, même en français, c'est
Un
pas évident.
compromis. Un compromis.
Le coût d'opportunité. Ouais, ça peut être ça. C'est-à-dire, il faut étudier deux situations pour choisir
Le
le
meilleur, quoi.
meilleur, n'est-ce pas?
Ouais.
All right. Very good. So, coût d'opportunité. Okay. Can somebody use that in a sentence in English? Anybody? Use that in a sentence in English. Coût d'opportunité. Opportunity cost. It's easy. You can just say opportunity cost is an important economics concept, right? That can guide decisions. Mr. Ganu,
Yeah.
do you know the meaning of this in French? Opportunity cost is an important economics concept that can guide decision making. Hmm?
Opportunity is an important economic concept
Mhm.
that can guide decision making.
Yes, for example, let's say Mr. Watara, who's the one who has the money in the house, right?
Yeah.
And you, Mr. Ganu, you are trying to buy some new computers
Mhm.
for your service.
Yeah.
And there is another one who says we have, cheap computers
Mhm.
from a different office, and
Okay.
they want to sell it to us.
Mhm.
So, um, what decision or what is your thought process in deciding what decision to take or to make in terms of buying one side or the other side? What will you think about?
Uh,
So what are you going to think about? Are you going to buy the new computers that are expensive, or will you buy the cheap ones that are available but old?
a new computer.
Why is that?
Uh, a new computer because I I I I hope that is it will work well than the computer the old computer.
I see. So you buy the new ones because they are more performant and they
Yeah.
function better than the old ones.
Yeah.
All right. So you will do that if you have enough money, right?
Yeah.
If you don't have enough money, or the money you need to split it in, with different activities, then you can think again and say, maybe if we get the old computers for cheap, we can do the other
The loss
activities
of
too. So
village
it's
that
yeah. So this is where the concept of opportunity cost
we receive is
is
from
involved,
that
right?
opportunity.
Yeah.
Yeah,
Yeah.
so it's an important economic concept that can guide decision making. So basically, I wanted us to have that idea. You need to think about many different parameters in order for you to make the decision. Good. Let's move forward. Trades off. What is trades off in French? Trade
Compromis.
off. Huh?
Compromis.
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 Okay. Compromis. Very good. Trade off is compromis. So can somebody use that in a sentence? Somebody can use that in an English sentence for all of us. Anybody? Everybody?
We
Huh?
we find we find we find trade off together to decide to take one.
We found trade-offs together to decide to take what?
One one computer.
Okay. So let's say buying older computers was the trade-off for us to maintain other important activities ADCNRFP. All right. Donc, acheter des vieux ordinateurs était le compromis pour pouvoir maintenir certaines activités qui sont importantes au niveau du centre. Does that work? Coordinated. What is it in French?
Coordonnées.
Coordonné. Very good. Use that in a sentence in English. Can you use that in a sentence in English? Coordinated. Can say that Mrs. Sana coordinated the purchase of office supplies with Mr. Sembu and Madame and Mrs. Gebre, for example. Yeah? Does this make sense? Does this make sense? Do you understand this? Oh, everybody's sleeping.
Madame Sana coordonne, les achats du bureau. L'ensemble des achats des supplies.
Les fournitures de bureau.
Oui, fourniture des bureaux en concert avec monsieur Sendou et Madame Guébré.
Very good. Now, let's talk about the price. Price. What does price mean in French?
Prix.
Very
Prix.
good. Yes. Price is prix. Prix. Okay, good. So, can somebody use that in a sentence for us? Use prix in a sentence for everybody. Now, if you want to speak, you can open your microphone. Si vous voulez parler maintenant, vous pouvez ouvrir le micro. Quand vous finissez, vous refermez. Yes. Donc, so, use pre or price in a sentence in English for us.
Price is the cost required to gain possession of possession of something.
Okay. To get the possession of something. Yes, this is the definition in a sentence. Price is the required something to buy to get possession of something. Excellent. Sorry about that. Okay, very good. All right. So now cost. What is cost? I think we already saw this word before. Cost, right? Okay, what is it? So do you want to use that in a sentence? Use cost in a sentence in English.
The cost is the amount of money needed to buy something.
Very good. The amount of money needed to buy something. Excellent. What is value?
Valeur.
Okay. In a sentence, what is it? What is it in a sentence? Somebody use valeur, value in a sentence for everybody. Are you sleeping?
No.
All right. Give me a sentence with value. Gold is a high value commodity. Who understand what it is?
The value of dollar is more than silver.
Excellent. This is very concrete. Value of dollar is higher than the silver. Excellent. Good job. Last one. Providers. What does providers mean?
Fournisseur.
Excellent. Use that in a sentence.
The provider is a person who gives someone something they need.
It is the person who gives someone the things they need. Pomenga twente to Magana Maharo. Aswang. Very good. So let's go for the next one. Payers.
Acheteur,
Payers.
payeur.
Payer. Good.
Acheteur, payeur.
All right. Use that in a sentence. Use that in a sentence. Payers. And you use that in an English sentence. Les gens de Bamfora là dorment. Il pleut là-bas aussi.
Oui, oui, non, on a beaucoup de coupures ici.
Ah, ok.
Il pleut fort, fort.
All right. C'est la saison. La pluie en train de dire au revoir peut-être. Good. Payers. Use that in an English sentence for everybody.
When we want to buy a gold,
want to buy gold,
we need professional payer.
we need professional payers. Yeah. So did you work in the gold sector or the mining sector before? Avez-vous travaillé dans le domaine minier avant? C'est ça, c'est une phrase de quelqu'un qui se connaît dans le domaine. This is a specialist sentence. Very good. Reimburse, reimburse. Can somebody read this for me?
Remboursement.
Remboursement, yes. How do you read it in English?
Reimburse.
Reimburse. Everybody, reimburse.
Reimburse.
Reimburse. Very good. So you're going to use that in a sentence in English for everybody. Reimburse in
Eh,
English.
eh,
Who knows? Qui connaît le mot qui correspond à emprunter en anglais?
Repay.
Yeah, rembourser, c'est repay, yes. Mais emprunter, c'est borrow. Okay. Yeah, so you can use borrow and reimburse in the same sentence.
no.
You can use borrow and reimburse in the same sentence.
When you borrow money
Uh-huh.
for someone,
Uh-huh.
you 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 have to reimburse.
Wow. That's exactly what I was thinking about. Yes, so when you borrow money from someone, you have to reimburse. Very good. Who was this again? Was this
Yes.
Gansore, right?
Yes.
Excellent, excellent, excellent,
Why would
excellent.
you write borrow?
Why do you have to borrow?
Yes.
Good question. Do you have an answer? Do you have an answer? Why do people borrow money? Why do people borrow money? Pourquoi est-ce que les gens empruntent de l'argent? Why do people borrow money?
To do something.
People borrow money to do business.
Very good. You can borrow money from the bank to do business. I love that example. Very good. All right. Any other example?
To pay scolarities.
Yes, to pay school fees. Very good. Any other example? But why do you borrow money to do all that? Can you not use your own money for it? Why you don't use your own money to do all this? Huh? Why you don't use your own money for business or to pay the school fees of your children? Anybody has an answer? Because you don't have enough money, right? When you don't have enough money to what you want to do, you borrow money. Mr. Simbu, is this clear for you now? This is why people borrow money. Very good. Supply. What is supply in
Yes,
French?
it is clear.
It is clear. Excellent. We are glad that now you have clarity. So, supply, what does it mean in French? Supply.
Une offre.
Hmm?
Offre. Offre.
Supply.
Une offre.
OK. Voilà. To supply, oui, ça veut dire offrir, oui. Oui. Mais il y a un autre mot plus approprié, supply.
Une commande.
No. Let's look again. Supply in French, what can it be? Supply. Hmm? Supply. Supply is what? Fourniture. C'est un mot, c'est pas un verbe, ok? Donc c'est fourniture. Offre là, offre c'est plutôt offer, ok?
Une offre.
Une offre c'est offer.
Mhm.
Good.
Ok.
Who wants to use this in an English sentence? Use supply in an English sentence. Use supply in an English sentence. Anybody? Supply in an English
Supply
sentence.
means
Uh-huh. Supply means what? Supply means what?
I have forgot the meaning of supply in French.
Fourniture.
The furniture. Supply mean a stock of the goods.
Excellent. Supplies is a stock
Of the goods.
of goods. Excellent. Demand. What is demand? Demand. It's the same thing as in French, right?
Demand.
Yo. Demand. All right. So somebody wants to use that in a sentence in English? Demand. Use that in a sentence. Use demand in a sentence. Anybody?
Demand is
Mm-hmm.
yeah,
Demand is
the the desire
the
to
desire.
desire
Mm-hmm.
to uh, purchase
To purchase.
to purchase
Mm-hmm.
good and service.
Desire to purchase
Good.
goods and services. Very good, Madam Kindo. Excellent job. Efficiency. The last word. What is it in French? Efficiency.
Efficacité.
Efficiency.
Efficacité.
That's efficacy.
Efficiency.
Efficiency. Very good. Can somebody use that or provide the meaning in English? So when we accomplish the maximum with the minimal resources, it is called efficiency. Okay? Donc, c'est quand on arrive à faire le maximum avec le minimum de ressources, ça s'appelle de l'efficience.
L'efficient.
Very good. Good job, everybody. We are done with the keywords. Now, we have 30 minutes to go through the lecture. Are you ready? Are you ready?
Yes.
All right. You are ready. That is good. Yeah. Oh, I see that somebody wrote approvisionnement. Yeah, ça c'est en rapport avec supplies là. Supplies, ça peut être également les provisions. That is good. I think I will need to add that. Okay. Supplies, ça peut être également provisions. Provision. Excellent. Thank you for the contribution. Now, let's do the PowerPoint presentation. So now we'll try to understand health economics. Definition of health economics. Who wants to read this for us? Somebody to read this for all of us.
Definition of health economics.
Madam Gansware,
Oui,
it's economics.
oui,
Try to say economics. Definition of health
economics.
economics. Okay, it's not
Definition of health. Definition of health economics.
Very good. Yes, keep going.
Resource allocation in healthcare.
Resource allocation in healthcare.
Resource allocation in healthcare.
Good.
Health economics analyzes economics.
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 Economics
Very good.
analyzes how limited resources are distributed within healthcare systems efficiently and fairly. Costs,
keep going.
benefits and outcomes. It evaluates the costs and benefits of healthcare interventions to optimize patient outcomes and societal welfare. Impact on society and individuals. Health economics help understand how healthcare decisions affect individuals, if health and societal well-being.
Very good. All right, let's review a few words. How do you read this one?
Resource.
Resource.
Very good. Resource, everybody.
Resource.
All right. How do you read this one?
Resources.
Excellent. Resources. How do we read this one?
Healthcare.
Healthcare.
All right. C'est pas healthcare, it's healthcare.
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 Very good. How do you read this one?
Fairly.
Fairly, everybody. Fairly. Excellent. How do you read this one?
Welfare.
Welfare. Everybody, welfare.
Welfare.
Excellent. This one.
Economics.
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 Very good. Economics.
Economics.
Don't forget that. Tomorrow we'll test it. Okay.
Economic.
How do you read this one? Don't read it like in French, please. Read it like in English. This one.
Societal.
Very good. Everybody, societal.
Societal.
All right. How about this one?
Well-being.
Well-being.
Well-being, everybody.
Well-being.
Excellent, excellent, excellent. Good jobs. So health economics is what? Allocation of resources. Okay, so it analyzes how limited resources can be distributed in healthcare systems efficiently and fairly. Efficiently means what? Efficient means so that all the activities that should be carried out can be carried out. Okay? All the activities implementation can happen, that is efficiently. And fairly mean that it has to be fair. What is fair in French? Fair in French. F-A-I-R. It means what? Hmm? Hmm?
Équitablement.
Hmm? Fair means, voilà. Fair, c'est juste. Okay? Donc, allocation of resources efficiently and fairly. Okay? And so cost, benefits, and outcomes try to evaluate the costs and benefits of healthcare intervention. It means, do we need to invest a lot of money and what is the outcome? Okay, so is there benefits in investing money in specific activity? So if we invest money, do we get benefits? So that is the benefit and outcome. So here, the benefit and outcomes is pretty much the same thing. And benefits refers to the welfare, because if you invest money in healthcare, you want to get the welfare of the population. Si vous investissez de l'argent dans les systèmes de santé et les soins, c'est pour à la fin avoir le bien-être de la société, de la communauté. So, this is what cost is, le coût, le bénéfice et les résultats. All right, so that is important. Now, what is the impact of all of that on the society and the individual? Donc, le bénéfice ou l'intérêt de cet investissement, c'est pour que à la fin, il y ait un bénéfice au niveau de l'individu et de la communauté, n'est-ce pas? Donc, c'est cela. Bon, tout le monde, je
Ouais.
vous ai muté. Donc, si en temps vous voulez parler, il faut activer le micro. All right, so that's what it is. The impact of health economics is the well-being and the welfare of the individual and the society. Maintenant, une question pour vous. What is the goal of health economics? Répondez en anglais. What is the final goal of health economics? What is the end goal of health economics? Activez le micro pour parler. What is the goal? Who knows what goals mean? Goals, ça veut dire?
But
But, yes. So what is the but of health economics? Health economics, what is the but? Health economics, what is the but? Hmm? What is the but of health economics? Hmm? What is it? The but is what? It's written here. It's here. This is the beauty of health economics. Can somebody read? This is the beauty of health economics. The goal of health economics is, somebody can
Is
read. Yeah.
individual,
Mm-hmm.
individuals'
Mm-hmm.
health and societal well-being.
Excellent. So the individual and the society, well-being and health and welfare. Okay. Very good. All right. Now we will move to the next slide. Okay. Are you still here? Is everybody here?
Yes,
Don't sleep.
yes.
Respond to the questions and follow, okay? All right, let's go to the next slide. Okay. So what does the next slide say? Next slide talks about the importance of health economics in healthcare. So it informs healthcare decisions. Remember, we talked about the example with Mr. Ganu. When you want to buy material, you need to think and make decisions, right? Okay, so informed healthcare decisions.
Oui. Oui, comment tu vas?
Informed healthcare
Oui, ça va.
decisions. So health economics,
Tu es là ou bien tu es parti?
health economics will
Tu es là?
help make
Bon, je
decisions
suis
in
en cours.
healthcare.
Bon, je viens te voir juste 1 minute et puis je repars, quoi.
Quand on est en cours,
Merci.
là, on ferme son micro.
Mhm.
Mr. Gano. Okay. So, informed healthcare decision. Health economics enables better decision making in healthcare. So, question pour vous. Why is health economics important in healthcare? Why is health economics important in healthcare? Somebody respond? Somebody read this? Why is health economics important in healthcare?
Enables
Mm-hmm.
better decision making on healthcare funding and policy to optimize outcomes.
Yeah, I like the way you said policy. Yes, that's how you read, okay? Very good. Policy, it's not policy. All right? You are learning,
Yes,
definitely. Very good. So, when they ask you a question with a why, when you answer, you need to remember to add because. Okay?
okay.
Did you understand that? When I ask you, why
Yes,
is health economics important? You should respond, because it's enable better decision making on healthcare funding and policy. Yeah? That clear?
yes,
Very good. So
yes.
now let's move forward with the next step. So it's important because it helps with better decisions. It also helps with efficient use of healthcare resources. Okay. It also helps support strategies to improve the overall health through better resource management. So all of these are why health economics is important to healthcare. All right. So the first one is because it enables better decision making. It ensures efficient use of healthcare resources that are limited, It also improves overall population health through better resource management. Did everybody understand that? Tout le monde a compris
Yes.
ça?
Yes.
Okay. So if I ask you, what are 3 reasons, just 3, what are the 3 reasons why health economics is important in healthcare? What would you say? What are the 3 reasons why health economics is important in healthcare? What would be your answer?
The 3 reasons
Yes.
to health economics importance are enable better decision making on healthcare funding and policy to optimize outcome, ensures efficient use of limits healthcare resources, and improve overall population health through better resource management.
All right, everybody clap for Shakira. Everybody clap your hands for Shakira. Good job. Good job. Good job. Excellent. That is awesome. Now,
Okay.
let's move to the next slide, okay? Move to the next slides. And this is about the basic principles of health economics. So, can somebody read this slide for me? What are the basic principles of health economics?
Basic principle of health economics.
Yes.
Scarcity of resources. Health economics is based on the scarcity of resources requiring carrying allocation to meet health care needs efficiently. Effectivity, opportunity cost. Opportunity cost highlights of value of alternative uses of healthcare care resource influencing decision making. Trades off in healthcare. Trades off require balancing competing healthcare priorities in limited budget and resources.
Very good. I want somebody else to try again. Anybody else who wants to try again?
Scarcity of resources. Health economics is based on the scarcity of resources requiring careful allocation to meet healthcare needs effectively. Opportunity cost. Opportunity cost highlights the value of alternative use of healthcare resources influencing decision making. Trade-offs in healthcare. Trade-offs require balancing competing healthcare priorities within limits, budgets, and resources.
All right, very good. Now, you both did a good job. Let's try to review a few words. Okay? We will review a few words together. And we will start with this one. How do you read this one? Do you see the screen? How do you read this?
Priorities.
Priorities.
Hmm?
Priorities.
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 Yeah,
Priorities.
priorities, everybody.
Priorities.
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 All right. How about this one? Somebody to try that one.
Budget.
Budget.
Excellent. Budgets.
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 All right. So how do you read? Everybody listen well and try to memorize. If you don't listen, you will not remember. We will learn something today and tomorrow you forget. And tomorrow you don't do it good job. So listen and try to repeat and remember. How do you read this?
Healthcare.
Healthcare.
Yeah.
Healthcare.
Healthcare.
Very good.
Healthcare.
All right. How do you read this one?
Require. Require.
Require.
Require, everybody. Require.
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 Excellent. And this one?
Requiring.
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 Excellent. How do you read this?
Highlights.
Excellent. Highlights, everybody. Highlights.
Highlight.
All right. How do you read this one?
Scarcity.
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 Very good. So they say that the basic principles of health economics, there are three. Scarcity of resources. That means that we do not have enough resources, right? We don't have enough money. We don't have enough healthcare workers. And based on that, we have to allocate. Very good. We have to allocate well to improve the health of the population, which means if you have 100,000 nurses, okay, nurses. What is nurse? What is nurse? Who knows? Good. So, yes, if in Burkina Faso we have 1,000 nurses, so will you take all the nurses and send to Ouagadougou? Est-ce que vous allez prendre tous les 1000 infirmiers et envoyer à Ouaga? Donc, il faut envoyer
No.
certains at the center and send others in the periphery, which means in villages, right? So it is important to do careful allocation. Donc, ça c'est que ça veut dire careful allocation. Ça veut dire quoi en anglais? Careful allocation. Donc, une allocation prudente. Okay, careful, prudent. Donc, allocation that is careful. Mean you send some in Kudugu, you send some in Ouagadougou, you send some in Machakwali. So everywhere have to get the resources for the healthcare to work. Donc c'est une allocation bien étudiée des ressources. Okay, parce que il n'y a pas assez de ressources. Who remembers the meaning of scarcity? What scarcity means?
Rareté des ressources.
Excellent. So if you have rare resources, you have to allocate well. Les ressources, quand c'est rare, il faut les allouer avec de la méthode, careful, avec prudence, okay? Opportunity cost highlights the value of alternative uses of healthcare resources influencing decision making. Le coût d'opportunité. So we have more nurses than doctors, right? In Burkina Faso, we have more nurses than doctors. Is that right? Is this true that we have more
Yes.
nurses than doctors? Yes. So since we don't have enough doctors, we cannot send doctors everywhere. Comme on n'a pas assez de médecins, on ne peut pas envoyer les médecins partout, n'est-ce pas? So, alors que les besoins en santé sont la même chose partout. In the village and in the town, the needs for healthcare is the same. And that is why we think of alternative uses of healthcare resources. L'utilisation alternative des ressources en santé. Cela veut dire quoi? Now, nurses, les infirmiers peuvent faire des diagnostics et des traitements, n'est-ce pas? But
Oui. Yes.
normally nurses do not do diagnostic. Nurses only do treatment, right? But because we have
Okay.
scarce resources now, nurses can do diagnostic in places where there is not doctors. In places where there are no doctors, nurses can now do diagnostics and also do treatment, right? If you go to Yalagado, do you see any nurse doing diagnostic? Est-ce que quand vous allez à Yalagado, vous voyez des infirmiers faire des consultations et des diagnostics?
No,
Why is that? Why?
because we have many doctor.
Very
This
good.
and
Because we have many doctors, and this is part of the doctor's assignment. The doctor's assignment and duty is to do diagnostic. Excellent. So this is what we call alternative uses of healthcare resources. Okay. Now we talk about trade-offs of healthcare. Trade-offs requires balancing competing healthcare priorities within limited budgets and resources. Okay. If you take, for example, how do you say? So in a village, you have what? Malaria, okay? You have bronchitis. You have screening of cervical cancer, okay? And now it's only one nurse for the whole village, and he has to do all that, right? Treat malaria, treat bronchitis, do cervical cancer screening, okay? So he will not be able to do everything because there are so many competing healthcare priorities. There are so many things that he needs to do. So he needs to prioritize, choose what he should do and leave the others, right? Choose what he should do and leave others. So that's how you prioritize. Or when you do not have enough resources, you don't have enough money, you have to choose what you do. You have to decide to do preventative curative or emergency care. So that's what it is, right? We already saw the vocabulary. Now, healthcare system. What is healthcare system? And somebody tell me, what is healthcare system? What is healthcare system in French? Yes.
Le système de soins de santé.
Excellent. Very good. So, can you read the definition in English for us?
Definition of healthcare system. The healthcare system is a coordinated network of people, institutions, and resources delivering health service effectively.
Very good. So the healthcare system is a coordinated network of people. Un système coordonné ou un réseau coordonné de personnes et d'institutions. That's what you call healthcare system, right? And it's also considered a resource delivering health services, right? So it's the network of people, institution, and resources to deliver healthcare services effectively. All right. Now, who can tell me what is health services delivery means? What is health services delivery? Anybody? Health services delivery?
Health self-deliver means health care system ensure population receive necessary medical care through
Through
organized service
through.
through organized service provision
Service.
service provision.
Very good. So healthcare service delivery is when the healthcare system take the service and bring it to the population, right? It's the provision of healthcare services. Excellent.
Delivery. What
Uh-huh.
what 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 meaning? The
Delivery
meaning
is
of
delivery is
delivery.
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 Delivery is when you take something and bring
Mm.
it somewhere. That's delivery. A livraison.
Okay.
All right. Excellent. So I think
Thank
we
you.
are at the top of the time. It's 4:30, right? So this will be the end of today's lecture. Is there anybody who has a question? Does anybody has a question for us before we stop today's course? Any question? Hmm? Any question or comment?
Me,
Yes.
when we learn E or EI.
Yeah, I know. E and I. Sometimes it's difficult to know when to pronounce what, right?
Yes.
I know it's a difficult one, but the best way for you really is to learn by doing.
Okay.
Learn by doing. So meaning you see it, you read, you memorize it for the next time.
Okay.
All right. But
Okay.
most of the time, the I, when the I precedes a vowel, you read it I. But when the I precedes a consonant, you read it E. Okay.
Okay. Okay.
Let me take a quick example. Take a quick example. I'm trying to open a Word document and I'll write and give you one quick example. All right. Can you see the screen?
Yes.
For example, you see the I here.
Okay.
Is it very small? Let me make it bigger. So when you see the I here, you see the same I here, and you see the same here. So this one is a vowel, right? Vowel is voyelle.
Mm-hmm.
And the I precedes, or the I come before the vowel. Okay? So
Mm-hmm.
you read this lie. This time the I, you
Lie.
read it I, okay? But
Yes.
this one is what? A consonant. This is also a consonant. So the I precedes consonants, right? I
Yes.
comes before consonant. So here you read it lipids.
Lipid.
Yeah, here it's lipid, it's not lipids, right? It's
Yes.
lipid. It's the same thing here because the I precedes the consonant. How will you read it?
Mm-hmm.
How will you read it?
Lead.
Exactly. It's lead instead of lied, right?
Okay.
Now, if you had a D here, if you have the E, meaning this one, there is a vowel in the group of words or in the group of letters that come before I, you will have to read this lied. Okay, for example, if you take the word collide, you see this is DE. You have to read this collide instead of collide.
Okay.
Yeah, so it's I know it's tricky, and this is why I say this is a small rule to help you, but you really have to learn it by doing, reading. And sometimes when you see a word and have the difficulty to know how to read or pronounce it, put it in Google and ask
Mm-hmm.
for pronunciation, and it will give you the symbol of, I think, a microphone or something, so you can easily try to learn it that way. Okay. Let me show you, for
Okay.
example, let me show you one quick example before we close. I'll stop sharing this and share this one instead. Remember, yesterday we talked about berries, right? So
Yes.
you can write pronunciation of berries, for example. Can you see that? So when you go here, do you see the microphone here? You see the
Yes.
microphone?
Yes.
So if you click on this,
Yes.
it tells you how to pronounce it. Did you hear?
Yes.
Let me, did you hear the did you hear the pronunciation? I don't think.
Yes.
No, I don't think you did. So listen again.
Berry, berry,
Berry.
Exactly. So when you click
berry,
on this, it tells you how to pronounce it. So this is how you can learn. You go to Google, you write pronunciation. Let's try, for example, let's see if it has something with your name. No, it doesn't have something. So yeah, that's all right. You can, for example, play a video and it'll tell you how to pronounce it. But yeah, this is how you learn. Okay? Because there is no umbrella rule. You have to learn by doing. Any other question
Okay.
or comment? That was a good question. Any other question or comment? All right. If no other question, I'll let you go. And then we'll meet on when? Tuesday next week? All right. You have a wonderful day and see you on Tuesday.
Thanks.
Bye-bye,
Thank you.
everybody.
Yeah. Bye-bye.
Goodbye.
Thank you.
See you.
See ya.